The federal government is tasked with coordinating the response to coronavirus. I think it's fair to say they have been behind the curve a bit. But of course, it is local governments that are going to have to make a ton of extremely important decisions in the days and weeks to come about how to balance taking steps to reduce transmission with the potential for big economic disruption. I'm joined now by California Democratic Congresswoman Karen Bass, who's a former physician's assistant and clinical instructor at the University of Southern California, and Democrat Eric Garcetti, the mayor of Los Angeles. Great to have you both. Let me start with you, Mayor. Obviously, we saw this in the Ebola crisis years ago, in which New York City had a confirmed case because a doctor who came back, and the mayor in that city's public health system was immediately had to perform at a very high level. What are your preparations like? How are you and the folks in this city thinking about this?
Well, it's more than preparations now. I mean, we have the fourth busiest airport in the world, the busiest seaport in all of the Americas. And so that monitoring and that work is already ongoing as we prepare for what we know will be landfall here. We've had a couple cases in Southern California. Those folks are home and they're well. But when we look at this right now, we're trying to just underscore that this is everybody's responsibility. It's not just a public health department, and we have a great county public health department here. We have the plans in place. But the chaos that breaks out when people suddenly don't go to work, don't go to school, when we see a cluster or a vector, we have to be really smart about this. For instance, one area that I'm concerned about is senior health facilities. Senior care facilities, as we've seen in Washington State, don't have the vents that you have in a hospital, have essentially medical personnel, but they don't have the protective equipment. And so whatever we can get from the federal government in assistance of that, I think we're very close here to declaring states of emergency as well.
You think so?
Not because we want people to panic on the cases, but because we have to be prepared for the federal assistance that comes with that. And we've already seen 5 counties do that in the state of California. And it's going to be very important for us to know that this is something in our own workplaces, in our own homes, that we have to take personal responsibility for.
There's a real question about training for healthcare workers. One of the things we saw in Wuhan, in China, was that hospitals and healthcare workers became essentially vectors for infection, particularly early on, before they were getting trained. How do you deal with that? How do you think about it as someone who was a healthcare worker yourself?
Well, that you absolutely have to move into education immediately. And I remember the Ebola crisis. I was in Washington, D.C. there. And I think one of the big things that's missing on a federal level is that this is an international issue. And so what President Obama did was he went out and rallied the world. And he viewed it from the point of view that if it's not contained in the world, then certainly it's going to come to the United States. But first and foremost, it's the education that has to take place with the healthcare workers. And if you remember when Ebola hit Texas, remember the nurses that were infected because the education didn't happen fast enough. So internationalizing it and then education for the healthcare workers.
At the level of sort of oversight and funding, which are the two things Congress is talking about now. I know the administration request had been several $billions. I think Democrats had said they looking at $15 billion, something on that order of magnitude. What is your sense of the back and forth between Democrats and Congress and the administration on this?
Well, we have an administration that views, unfortunately, everything from the lens of himself personally. And so he's viewing this politically. He didn't want to really admit that all of that was needed. Remember, he said as soon as it gets warmer, we don't have to worry about it. It's going to go away. But with an administration who has lied to us on a daily basis for 3.5 years, this is when you need to trust the government the most. One of the problems that happened in Ebola, and actually continues to happen today, is that some of the countries where people are infected, they don't have the confidence in the government. So then they don't pay attention to the instruction.
In fact, the one big lesson of this is that governments that repress information and try to tamp it down end up with the worst outbreaks.
That's
what happened in China early on, and Iran. Iran right now is in really bad straits. We don't have the actual numbers because we can't trust their data, but that's precisely what happened there. I mean, that is the lesson, right? If you're not clear and transparent with people, if people can't trust the government, and if they try to sort of get away with happy talk, as a lot of oppressive regimes want to do, then you end up with a problem.
Can I give you an example? I mean, one of the things that's happening is everybody's running out and buying masks. And that's not what's needed. And they're buying so many masks that the places that actually need the masks, which are in hospitals, there is an absence.
And, you have healthcare workers right now. I think the main hospitals are well prepared for this. But remember, we have a whole still network of smaller hospitals, community clinics, places where immigrant communities of color go, lower income folks folks go. And that's not getting down to that level. That's where the federal government could make a huge difference with helping us.
There's also a question about testing. I mean, there's fears people have. There's this sort of viral case of a guy that came back from China, had a fever, went and got a test in Miami, got a bill for several $1,000s. There's other people who were evacuated out of China by the U.S. government who now have getting billed. There's a real, I mean, what do you say to people, to Angelinos, about who are like, I don't want to get tested, it's going to cost me money, or I don't want to take days off work because I don't have sick work.
First of all, I'm old-fashioned. I think the federal government should foot the bill for this. This is about protecting Americans first and foremost. Secondly, like so many things we have to do where the federal government's not there, we will step up at the local level and do that. But hopefully we'll get those reimbursements. And we want to encourage people also to look. I mean, in Japan, in Korea, you're having people who have drive-through testing, you have mobile testing.
Yep.
This is the kind of thing we can do so everybody doesn't rush to these hospitals and further spread the disease when it comes.
But one of the problems is that there are not enough tests. I mean, I heard they were sending a couple of thousand tests out. There needs to be hundreds of thousands of tests. And the other thing that I worry about coming from White House is talking about a vaccine. Vaccines take years to happen. So misleading people to think that that's going to come soon is a real problem.
Quickly, you're both voters here. So Tuesday tomorrow, you have your candidate.
I do. I'm one of the 3 national co-chairs for Joe Biden.
And that was early on.
Yes, absolutely. It was, and I love all the candidates that are here. He helped us raise the minimum wage, make community college free, was out there on the climate before anybody I knew. And so I think that this city is grateful for what he has done. And even with an extraordinary number of folks that are talented, he is the guy who can unify us, and he's the guy who can win.
Congresswoman, I don't think you've endorsed. You want to make some news right now?
I have not endorsed, and I will just say that whoever is the nominee, I am going to be there with bells and whistles. Absolutely.
All right, Congresswoman Karen Bass, Mayor Eric Garcetti, it's great to have you both here.